Hello guys, welcome back to That Filipino Nurse channel. My name is Boyet Ventura. I am a Filipino nurse working here in Ireland, and this channel we share our experiences working and living as a nurse here in Ireland. I also post travel videos done in and out of the Emerald Isle and also some parts of Europe. Guys, it's been a long time since I've done a nursing vlog. So for today, I'm going to share with you my nursing interview experience in an acute hospital for an ICU staff nurse post. So if you are a nurse looking to be interviewed by an employer, specifically here in Ireland, this video is for you. And if you haven't subscribed to my channel already, please do click the subscribe button and give this video a thumbs up for fun. I'm gonna cut to the chase and proceed with this vlog. So guys, nowadays it's all online. Interviews, classes, whatever it is, majority of it are done online. So my interview was via MS Teams. Before the interview happened and before the invitation to MS Teams, I filled out an application form that was sent to me via email from the hospital. And basically it's like your CV, but so it's a form where you will put your clinical experience, your competencies, your educational background. It's pretty much the same as your CV, but it's just their form. It's what are in those forms, just to give you an idea. The first part of the form includes your job experience, your position title, your employer, your department, and also the inclusive dates that you work in that hospital or in that institution. And it's important that you put all your clinical experience so that they can assess your level. Also, it's important your salary will be based on the years of experience that you already had in your nursing career. So the second part of the form is just your contact details. And then the last part of the form contains your competency questions. You have to put like an essay kind of answer for all the questions. In this area, you are required to describe and write down clinical situations that showcases your ability in specific skill areas. Planning and organizing, building and maintaining relationship, and quality service. There were two of them who interviewed me. So the first part, they introduced themselves to me because they already have my CV. They were holding my CV and they were reading through and scanning through my CV and trying to validate it with me. After scanning my CV, they asked me to explain my clinical experience gaps, just a short explanation whether or not you were trying to find jobs or you're out of the country or whatever. So for the second part, guys, they asked me to describe my current job, which is ICU staff nurse. They asked me a few questions about the staffing, about the bed capacity, and also about the usual cases that we cater in our ICU. So to say whatever your unit is catering patients with multiple organ failure, ARDS, or acute kidney injury, COVID pneumonitis, post-operative patients who are critically ill. And the conversation was kind of smooth and it was really light. There wasn't really pressure because it's just a conversation. You just have to relax and kind of smile and be polite with them and just say it in a manner that you're used to. If you're used to speaking a little bit slower, that's okay as long as they understand what you're saying. Very patient with applicants, and if you didn't get what they said the first time. The third part of the interview are the clinical scenarios. I was kind of nervous because I haven't been interviewed for a long time. At the same time, I've been working in the ICU for quite a while now. So, in your head, you know all of these things, but in an interview, there's always something that you're gonna miss, no matter what you do. So in every question, just take time to think and kind of answer calmly and gather your thoughts rather than rushing through it and making lots of mistakes. So the first clinical scenario they asked me is they want me to describe the process of admitting a urosepsis patient from resus to ICU. They just said, take me through the process that you're gonna go through if you're admitting a patient like this. This interview experience is based on my experience. It can vary from person to person. I just want to give you an idea about my experience, and it could be different for other people or other nurses. My answers, and I wouldn't say that it's 100% correct. Just for the purpose of describing the interview, I'm going to share to you my answers. Do your research before you go to the interview. so that you can nail it and get that job that you want. So here guys, I brought myself back to work and thought about admitting a patient to our unit. So I just said I'm going to talk to the resus nurse or the ED nurse and ask about the diagnosis of the patient, whether or not the patient is ventilated, kind of supports he's on, vasopressors, does he have infusions like sedation, analgesia, the things that we have to prepare, these kinds of things, so that we can draw up these drugs and prepare it in the bedside. Prepare our bedside, set up the ventilator, make sure that the device was checked, suction is working, oxygens are working, the C circuit is on standby, and then all the infusions are already in place and ready to go once the patient arrives. And also make sure that you have enough staff to receive the patient safely, and yeah, that's it. If you have any other thoughts about it, please do leave it in the comment section below so that we can learn from each other, and also people can learn from it by reading those comments as well. If you want to add something, and please do, if you have something in your mind, just put it in this comment section. So for the second clinical scenario, you have a patient who's just into the door of your ICU bed space, and then suddenly the patient desaturates. What will you do? So for this scenario guys, they didn't really specify if the patient is ventilated or what's going on with the patient. So I just assumed that the patient was ventilated. Think about your ABCs, your airway, breathing, and circulation. Think about airway first. Check the patency of the patient's airway. Also give a quick look at the saturation probe. If it's intact or patient's cold and clammy, you can put it somewhere else, like in the forehead, or just think about of these things, and make sure that there's no disconnection in the ventilator circuit, or think about whether or not patient needs suctioning. If you don't know what's happening and you can solve the problem, you can always disconnect the ventilator and bag the patient with 100% O2 using the C circuit until you figure out what's wrong with it. It could be a lot of things. It could be the patient is having bronchospasm, or sputum plug, these kinds of things. So what they want to hear from you is that basically you're going to keep the patient safe. They will be assessing about your critical thinking skill. You want to assess your reaction in these kinds of situations. You want to know that you'll be calm and safely prevent patient from deteriorating. Okay, so another topic that they asked me to discuss is about planning and organization. They asked me to describe my day from start to finish, or the first things that I do. Like they basically said, if you step into your unit right now, what are the things that you will do? Take us through your day, your prioritization. What are the things that you're going to do first, and what are the issues that you'll be addressing first in your shift? If they hear that you know how to prioritize and you know how to organize your day, that you'll be safe and efficiently look after the patient, and then I think that they will stop there. So I just told them my normal day-to-day workflow in the ICU. I start with this, I start with that, I plan this, I plan that. I'll make sure that the patient's issues are being addressed, and I make sure that I relay them to the physician or to the anesthetics, prioritize whatever is urgent. It all boils down to the safety of the patient as well. So basically telling them what your day is like in your current job. I'm sure you know all of these things already. Whatever abnormal findings that you found during your assessment, if it's really urgent, you have to relate to the doctor, be proactive. If the doctor is not around, you bleep them, you have to say this and that, you have to talk to your manager, and you have to be kind of snappy with things that's happening around. If you're working in the intensive care, all your patients will be critical. You can't delay things. They need to be done. It has to be done. So the next question is about communication and teamwork. One of the interviewers asked me if there is a doctor, a junior doctor, that's ordering something for the patient that I don't agree with, what are you going to do? Here in this question, I think they want to know if you are aware of the proper escalation of things. Just think about that, just answer based on your knowledge about proper escalation. So if I don't agree with the doctor's order, I would discuss it with the doctor professionally and respectfully, and give my rationale about the thing that I don't agree with. If it's a dosage of the drugs that I think that is wrong, or if it's something that I think is not safe or dangerous. So if it's an order that I think that is unsafe, or something that I'm not familiar with, the doctor might be right, I might be wrong. But if I have self-doubts, whenever you're in doubt, just make sure to confirm it with somebody who is senior than you, or your manager, or can be the consultant as well. Make sure that you escalate it to your line manager. Basically go from there. Another question is about preceptorship. So the question was, if you are teaching a newly graduate nurse who is starting to work in your unit in the ICU about vasopressors, what are you going to say to the nurse? What are you going to say, and how are you going to teach the staff about this? I will just explain what the vasopressor is, why do we use it, can discuss the rationale behind all of these principles as well. I won't tell it to you because you can do your research and you know all of these things. Pinpoint some major side effects of this drug, like for example, it can cause ischemia. Cautious about titrating it, that it has to be infused into a central line. Make sure that you mention all these important things about the vasopressor, side effects, how to titrate it, how to administer it, these kinds of things. Again, it all boils down to looking after the patient's safety. Quick break: if you haven't subscribed to my channel already, and if you are into nursing vlogs, or if you are looking to work or live in Ireland, or just visit Ireland in general, then you can watch my other video. Please subscribe to my channel. We appreciate it, and thank you guys for subscribing already if you are, and if you're watching this, thank you so much. Thank you so much for watching until the end. But the last question that I encountered was about delirium in the ICU. So I was asked to discuss about the treatment of delirium in our ICU. So delirium is pretty much a big issue in the intensive care. 50% of the patients in the ICU suffers from delirium, and it is also associated with 3-fold increase in 6-month mortality. Delirium increases the hospital cost, and also delirium causes cognitive impairment post-hospital discharge, and there's a lot of nasty stuff that delirium causes. So if you're going to apply for an ICU post, just make sure that you read about delirium and how to prevent and treat it. Make sure that you just discuss about all the prevention measures for delirium before you discuss about the treatment. So all critically ill patients should be assessed for delirium using a validated tool. Now it depends on what you're using in your facility, but in our ICU we're using the CAM ICU, which is the confusion assessment method in the intensive care unit. As long as you know kind of the basic foundation of the prevention and treatment of delirium, then you're good to go. So with delirium, just remember the ABCDEF multi-component interventions for the prevention of delirium. So A is for assessment, prevention, and management plan. B is for both spontaneous awakening and breathing trials, so your sedation holidays and your weaning from the ventilator. C is for choice of sedation and analgesia, so make sure that your patient is not in pain and make sure that your patient is comfortable and steady. D is for your assessment of delirium and management. This includes your confusion assessment method. E is for early mobility and exercise. Make sure that you mobilize your patient as soon as they're able. F is for family engagement and empowerment. Just remember the ABCDEF multi-component interventions in prevention of the delirium. So this is from the Society of Critical Care Medicine. There are like plethora of things that we can do about delirium, but in an interview you have a short amount of time to mention everything. Just make sure that you read about delirium and you know about the prevention and treatment. How do you maintain health and safety in your unit? So for this question, guys, initially I was able to give them the correct answer that they want to hear from me. And what I said initially was, in our unit we have these policies and guidelines and protocols for different kinds of things. She then asked me, what about your infection control protocol? Yeah, if we're admitting a patient from a different unit, we usually ask if there's an ongoing infection that we need to be aware about. All those kinds of infections we need to know prior to transfer to ICU, so that we can prepare the bed space or the proper PPEs to be put in place for that particular patient. So when the patient comes in, we also do the admission swab just to make sure that they don't have bugs, or we have to implement the proper precautions for that patient, whether it's a airborne precaution or a droplet contact. Otherwise, we're doing standard precautions all the time for every patient that we look after in the critical care. You can add there your 5 moments of hand hygiene, which I'm sure you all know, I don't have to say that. So guys, that's it for our today's vlog. Thank you so much for watching this video. If you have an upcoming interview, preparation is the key, and I'm sure you will nail it if you do prepare. So good luck to your interview. Continue pursuing your goals and your dreams, your aspirations in life. You'll reap the benefits of all your sacrifices at the end of it, and I'm sure you'll be successful in whatever you put your heart into. So please don't quit and don't stop and don't give up. Yeah, thank you guys for watching this video, and I hope to see you next time on my next nursing vlogs or travel vlog. If you want me to do other vlogs as well, please do tell me. My ears are open. Thank you so much. Goodbye.